In 2008, over 616,000 people died of heart disease. Heart disease caused almost 25%, or 1 in 4, of our deaths in the United States. And every year, about 785,000 Americans have their first heart attack. Another 470,000 who have already had one or more heart attacks have another. So you are at risk, especially if your heart attack was more genetic related or came from some other circumstances. You're not fixed. Yes, they may have put a stent in, or they may have done some type of intervention, but now we have to prevent that stent from clogging again. We have to prevent whatever made it occur. These are the percentage of U.S. adults with heart disease risk factors from 2005 to 2008. 53% of U.S. adults reported inactivity or sedentary lifestyle, 34% obesity, 32% with high blood pressure, 21% with smoking, 15% with cholesterol or high cholesterol, 11% with diabetes. In 2003, approximately 37% of the adults reported having 2 or more of these risk factors. All right, these next slides that we're going to go through they're from the Centers for Disease Control, the CDC. They cover obesity trends among U.S. adults, and what's going to happen is you're going to see as the colors get darker, those states are becoming more and more obese. The obesity rate is increasing. So obesity meaning over 30 pounds overweight, or around 30 pounds overweight for a 5'4" person, or a BMI over 30. The black states right here have no data as of these few early years, but they will. So you can see we're getting darker, turning dark blue, and you see some of those southern states tend to pop up first. And here we go, East Coast into the west. Now our East Coast is turning a whole different color. There's over 20% obesity now. We're not done yet. That was 2001. Here we go, orange. That's over 25%. And there's some more southern states coming in here at over, I believe it's 30%. And there it is. That was as of 2009. So you can see a majority of our country, other than one state, has over 30–35% obesity. Our heart is a muscle, so it needs exercise. So therefore, that's why we prescribe cardiovascular exercise. We're going to talk about the exercise prescription as far as that goes there at the end. But it does strengthen the heart muscle, improve circulation, improves symptoms of congestive heart failure. That's what CHF is. Improves our energy levels, increases our endurance, decreases our blood pressure, improves sleep, and it can decrease stress, tension, anxiety, and depression. These are some studies that were done. This is STRIDE, a study that covered 111 overweight sedentary men and women. There were 4 groups. There was a control group. There was a group 1 that had high amounts of exercise with a high intensity, which means they were jogging about 20 miles a week. Group 2 had a high amount with a moderate intensity, so maybe they were jogging about 12 miles a week. Group 3 was low amount with a moderate intensity, so they were walking about 12 miles a week. All of these groups showed improved lipid panels. So the proof coming from this study being that, like Dr. Fath was saying, you don't have to do something extremely intense. These people were walking a couple days a week, and they were still able to improve their cholesterol and triglyceride numbers. This is a women's health only study. This was a 10-year study that followed over 27,000 women that did not have current heart disease. 979 of those women developed heart problems. 253 of them had a heart attack. 398 of them had angioplasty. 219 had bypass. The study studied exercise in these individuals, and the moderate exercise decreased the risk of their heart disease by 27 to about 40%. So it made a huge improvement on their risk for heart disease. Almost none of these participants lost weight. So this wasn't talking about people going in and trying to lose weight. This was just talking about them trying to manage their risk factors. If they lost weight, it contributed to about a 10% reduction of heart disease. A modest decrease in blood pressure had about a 27% effect, and a decrease in their cholesterol and lipids had about a 35% effect. Improved diabetes control had about a 9% effect. They also found exercise can decrease the inflammation in the body and make it more difficult for blood to block and clot the arteries. Inflammation is when the molecules are released and cause damage to the blood vessels, so we have injury somehow to the blood vessels. We then have inflammation, and then with that injury to the blood vessel, then we have deposits that start to build up. So the cholesterol begins to deposit there and leads to plaque buildup. The platelets then attach, and then the clumps break off in the blood vessels, causing a stroke or a heart attack. So it's kind of, exercise can help decrease that inflammation process from happening in the first place. So this is just a little picture in case you've never seen one. We have a healthy artery, and then on the other side there, we have an artery that has been obstructed by the plaque due to whatever reason, maybe some type of injury to that blood vessel causing the inflammation, and then the plaque and platelets beginning to form. And then what happens is one of those clumps breaks off and goes and clogs an artery somewhere. If it's on its way to the brain, then that's when it's a stroke. Usually, and if it's on the way somewhere in the heart, that's when we have a heart attack. So the major points of this study is if you exercise, you can decrease inflammation, which decreases your number of cholesterol deposits, which decreases your risk of heart attack and stroke. It's important for all people to exercise, no matter what size or weight you are. As little as 2 hours a week of brisk walking can decrease your risk dramatically. This came from this study. The effects of exercise on specific disease processes: coronary artery disease, you have a decreased risk of developing it by 45% just because of exercising. Cholesterol, LDLs can be benefited by low to moderate levels of exercises. However, HDLs is more or less going to have an effect on with intense exercise. So a little bit more high intensity exercise can increase those HDL numbers, which is your good cholesterol. Those are the numbers that he was talking about. He wants above 50 or 60, ideally. Blood pressure. Exercise conditions the blood vessels to be more flexible. So when you're under stress, maybe the blood pressure doesn't rise as much because the blood vessels are a little bit more flexible during this time. They ensure good blood flow and normal blood pressure. A sedentary person is at a 35% greater risk of having hypertension or high blood pressure. Heart failure. Patients that have heart failure should have medical supervision only. Not all patients with heart failure can exercise. That's something that you have to consult a physician with. And they actually talk more about resistive training or strength training with our congestive heart failure patients, or just small interval exercises. So walk for 2 minutes or bike for 2 minutes and stop, or a minute and then stop, and then another minute and then stop. But again, that's under medical supervision. Stroke patients, we have a decreased risk of stroke, which we talked a little bit about earlier. There is a medical evaluation that you should have, and really you should have that before starting any exercise, of course. Those at high risk, that should definitely be carefully monitored during exercise sessions. These are just examples. This is not all inclusive. Patients with uncontrolled diabetes, patients who have seizures or a history of seizures, uncontrolled high blood pressure, a history of a heart attack, heart failure, unstable angina. Angina is chest pain. It's another word for chest pain. Aortic valve disease, aortic aneurysm, and a moderate to severe hypertension. First of all, with aerobic exercise, it's the body's ability to sustain endurance exercise. But most people think, I don't need to do strength training because I walk a lot, so my legs are strong. Okay, cardiovascular exercise is really meant to work the large muscle groups of the body, which are the largest muscles in your body are the legs. So you're working your legs, but you're working your legs for cardiovascular purposes. You're not necessarily strengthening those legs. You're not strengthening the bones in those legs as much as you could be sometimes with the strength training. So cardiovascular exercise and the strength training are both going to be strongly recommended on 2 separate occasions there. So when we look at cardiovascular exercise, it is always going to be usually something that exercises the legs because they're the largest muscle group of the body. They're going to demand the most oxygen be pumped throughout the body. Therefore, they're going to acquire a higher heart rate for a sustained amount of time. And that's what we're looking for cardio exercise. So we're looking for, like Dr. Fath says, that continuous exercise. So whether it's walking 15, 20 minutes straight, walking 30 minutes straight, biking, ellipticals, water exercise, whatever your mode of exercise may be, just that sustained for a period of time. Guidelines, 3 to 7 days per week. I usually always tell people have a day off and warming up and cooling down appropriately. So you want to make sure that you warm up for about 5 minutes before and cool down for about 5 minutes before you're done. So coming into it, you're not just hopping on that treadmill going 4 miles an hour for 20 minutes and hop off and you go sit down. We need to build our way up and then work our way down at the end. So just make sure you have that warm-up period. National Physical Activity Guidelines recommend that you do 300 minutes of cardiovascular exercise in a week. So if you break that down, that's of moderate intensity, low to moderate intensity. If you want to make that exercise more vigorous, you can cut that time in half. So if you're looking at a very brisk walk, intensity kind of depends on you, what's intense for you, but you're looking at 150 minutes a week of vigorous intensity exercise. So you can cut that time in half. Overall, the guidelines for strength training are going to be 8 to 10 separate exercises for the major muscle groups. So something for the arms, the legs. You have different muscles in your arms. So you have biceps and triceps. You have chest. And then you have some squats that you can do. So just to kind of try to hit all the muscle groups of the body. So it usually is going to take about 8 to 10 different exercises to do that with one set or 2 sets of 8 to 12 repetitions. And then at the bottom here, exercise each muscle group 2 to 3 times per week on non-consecutive days. So which means you would do it, if you do all those exercises on Monday, you're not going to do them all again until Wednesday. These are some resources, the CDC.gov, ACSM, which is American College of Sports Medicine. That's who our governing body pretty much is in cardiac rehab and pulmonary rehab. They have exercise guidelines for pretty much every disease population there is, in any disease process there is. So they have a lot of information and it's very credible information.